Welcome back to the Parkinson's Doctor YouTube channel. This is Dr. Ramon Rodriguez, board certified neurologist and movement disorder specialist in Orlando, Florida. And today I have a video where I will be speaking about biomarkers in Parkinson's disease. I will explain what biomarkers are for you to have a better understanding. And the reason for this video is that after the video from last week where I was presenting the blood test for Parkinson's disease, which is not yet approved to be used in people to make a diagnosis of Parkinson's disease, but these are very interesting findings. I read your comments on the YouTube page, and I also received quite a few emails in my Learn About Parkinson's page and blog, and I want to answer those questions for all of you, and I'm sure that there will be some of you that would like to know some of this information and understand a little bit better what status are we, right? So what I'm going to be discussing now are biomarkers for Parkinson's disease. And let me explain to you what biomarkers are, right? So a biomarker in medicine is a measurable indicator of some biological state. And this can be the presence or severity of a disease or a response to a therapeutic intervention or even normal biological processes. So let me explain to you what this means, right? Let's think about diabetes. In people with diabetes, we can measure the blood glucose, the sugar, and we can tell if the sugar is high, that the diabetes is worse, and if the blood sugar is within normal range, then that person has been taking the medicine or following a diet or is doing what they are supposed to be doing in order to keep their condition under control. Another example of a biomarker is the PSA, the prostate-specific antigen. And this is a blood test that helps doctors measure the activity, for example, of a prostate cancer, right? So when the person has a PSA that is increasing, and what is telling the doctor is that the cancer might be coming back or that person might be developing a cancer. So further testing needs to be done. So biomarkers are very interesting because in first place, we want to know if a biomarker tells us that the disease is present. And then in second place, whether the biomarker might be able to tell us about the progression of the condition. So last week, I talked to you about this blood test to diagnose Parkinson's disease. And I had mentioned that at this time, the test is mostly intended to be diagnostic, but it does not measure the progression of Parkinson's disease, as far as we know. And it can differentiate and the other question is whether it can differentiate Parkinson's disease from other Parkinsonian syndromes. So at some point, we have a video that where we discuss what is a typical Parkinsonian syndrome or a typical Parkinsonism. So that will allow you to understand a little bit better what that is. However, let's go ahead and move on and talk about other possible biomarkers. And these biomarkers are very important, right? And they are very important because, at least in my experience, one of the main challenges and obstacles that we have when we speak about Parkinson's disease and either finding a cure or finding something that can help slow down the progression of Parkinson is that we do not have at this time a biomarker. We do not have a test that will allow us to follow those patients over time to understand if the intervention that we are doing, that medicine or that procedure that we're doing, is actually slowing down the progression of Parkinson's disease or is taking the patient to a cure. So we need to find a biomarker, and there is a lot of research trying to answer the question whether we will be able to find a biomarker for Parkinson's disease or not. So there has been a lot of questions about the skin biopsy for Parkinson's disease, right? And this skin biopsy is actually called the SIM1 test. And this is very interesting because this is the first commercially available test of its kind. And basically what this test will do is it will find whether the person might have the abnormal protein called alpha-synuclein in cutaneous nerve, right? So these are nerves in the skin. And this delivers about 95% sensitivity and specificity. What it means is that this is a really good test. The test is able to find the people that have alpha-synuclein. And For those of you that don't know, alpha-synuclein is the abnormal protein that deposits in the brain of people with Parkinson's disease. However, it also deposits in the brain of people with other Parkinsonian syndrome. And right here in the slide, I have the multiple conditions that are characterized by deposition of this alpha-synuclein, which are Parkinson's disease, dementia with Lewy bodies, multiple system atrophy, pure autonomic failure, and we have people with REM, sleep behavior disorder, that have a positive test for alpha-synuclein. So at this point, the best use that I have for this test is, sometimes I have a person that is having multiple symptoms, but we cannot make a proper diagnosis of Parkinson's disease. And sometimes getting the test and seeing alpha-synuclein will tell us, yes, we're dealing with a Parkinsonian syndrome in this case, and this might be an atypical presentation. Another situation where I have seen the skin biopsy use is, we spoke before about atypical Parkinsonian syndrome, so progressive supranuclear palsy, corticobasal degeneration, and others. So the use of the skin biopsy, if it tells me that that person is having alpha-synuclein, then it directs me into the list of diagnoses that we see here: Parkinson's disease, Lewy body disease, multiple system atrophy, pure autonomic failure, or REM sleep behavior disorder, rather than one of the other conditions that are mostly associated with an abnormal protein deposit called tau. So this is very sensitive and specific. It actually helps me to try to understand in which direction the patient is going. But number one, it is not diagnostic of Parkinson's disease. And in second place, it does not let us measure the progression of the Parkinsonian syndrome. So we still are looking for that biomarker. Let me talk to you about something that is kind of interesting, because historically we have been looking for a blood test or something in the cerebrospinal fluid, or is there something that we can find via imaging? However, there are multiple companies working on trying to find if we can measure the progression of Parkinson's utilizing digital biomarkers, right? So we're now in the digital age, and as you can see, I wear an Apple Watch, and these watches are very well known because they can collect a lot of information. So these technologies obviously might be able to measure how well you walk, what is the speed, what is the stride. It can measure how well you're sleeping. It can measure the severity of the tremors, how frequently you're having tremors, how frequently you're having dyskinesia. So these companies are developing multiple algorithms that they can use in these wearable devices or their smartwatches that might be able to give us a reflection of what is happening with the Parkinson's disease. So I personally, I am very interested in knowing about this, because maybe the answer is not inside the body, but attaching something to the body that might be able to give us a better picture about what is happening to that person at home. And this is not only important, to try to find something that might be able to help slow down Parkinson's disease, but also understanding better what is happening at home, for doctors to be able to more precisely adjust the medicine. So I just came across this article about a company called Conexa at Northwestern University. They were awarded a grant from the Michael J. Fox Foundation to investigate speech symptoms in people with Parkinson's disease. Right. So once again, well, they're going to be using these devices, trying to figure out, obviously, for certain things, the watch will be able to measure what is happening, but there's also an opportunity to use a cell phone to measure the voice and measure the progression of voice changes over time. So very, very interesting. I'm really looking forward to hear what is in store for these kind of devices, because this technology is just advancing. And in the last Movement Disorders Congress, I came across multiple companies that already have products that could help measure what is happening at home in terms of the frequency of the tremors, how much time is the patient spending in the on time, how much time is the patient spending in the off time. So that will help me as a physician calculate the better dose of the medication for the patients. And then we have spoken about this before, the DatScan, right? And DatScan, just for those of you that do not know what the DatScan is, it's a nuclear medicine study. It's a very sensitive and specific test. And what this test will do is that it will identify a specific part of the brain called the striatum. Shows in the test, it will show up as a dark or a decreased signal. So what I want you to see here is, if you look at the image on the left side, what you will see is that there is that coma shape in orange color, and it is quite symmetric in both sides. But when you look on the right side, you see that the images are smaller, right? And they're even asymmetric. One side is smaller than the other side. So when we see a person just like on the left side, we say that that is a normal scan. But on the right side, that abnormality is suggestive that there is a problem with the cells that deal with dopamine in the brain. So unfortunately, the DatScan is not able to tell us at this point about the progression of Parkinson's disease, but it will at least help us, letting us know that there is a dopaminergic deficiency. But just like the skin biopsy, it is not specific for Parkinson's disease. There are other conditions that will have a positive DatScan, such as Lewy body disease and multiple system atrophy. So up to today, and today is the 24th of February 2024, we don't have a test that will tell us exactly if a person is developing Parkinson's disease. We do not have a test that will tell us what is the progression of the Parkinson's disease in that person. However, there are multiple projects going on trying to answer that question. And as I mentioned before, this is very important. And the reason is that as we're looking for medications or procedures or whatever it is that we're looking for that can help slow down or cure Parkinson's disease, we need to have a biomarker that will help us identify how the process is going over time. So other companies and universities are also working hard to find these optimal biomarkers in people with Parkinson's disease. So, if you speak with your doctor and they talk about this, now you understand a little bit better, and you might be able to participate even in those research studies trying to answer the question of, can we find a biomarker for people with Parkinson's disease? Once again, for more relevant information, make sure that you subscribe to the YouTube channel at the Parkinson's Doctor. I am working on multiple videos that will be coming in the next few weeks. I will be speaking about vitamins, the vitamins that you need to take, or that I recommend to my patients with Parkinson's disease. Let's put it that way. And we're going to discuss multiple alternative medicine interventions. So we're going to talk about red light therapy. We're going to talk about vitamin B1, and we're going to talk about mucuna, and then what other supplements might be available to help people with Parkinson's disease. So I really appreciate your attention. Make sure that you subscribe so whenever those videos come up, you learn about them right away. And I look forward to our next video. Thank you very much.